Hi, I'm Dr. Maggs. Welcome to this week's Concerned Parents of Young Athletes Sports Medicine podcast. I'm excited to go through it because we've got a lot of great information, and this information, truthfully, the world really does need to hear it. So, why injuries are up. And we've gone through so many injuries with so many families, and I have a belief that when an athlete is injured, the family is injured because it affects everyone in the family. So why are injuries up? The simple answer is because today's system is ignoring, not by choice, they don't know, is ignoring the cause of the injuries. And it has to do with the fact that the human body is not symmetrical. So we'll call it the mechanics or even the biomechanics. In our sports medicine industry today, no one looks at that. We are a reactive system. And I listened to a podcast the other day. Byron Scott of the Lakers interviewed Gary Vitti, the longtime, very successful trainer of the Los Angeles Lakers, and asked him, why are injuries up and what's different today than it was back then? And Gary, who is very articulate and certainly has a massive amount of experience, but what he doesn't know is that he doesn't know the underlying mechanics of the athlete because no one ever provided him with that information, because those tests didn't exist and don't exist today except for the tests that we are very much trying to get out there today. And so he talks in terms of kind of philosophical, the faster, stronger athletes today. What they do is, the speed of the game will cause an increased tightness of the hip flexors, which will now increase the tension of the glutes and the hamstring, which now leads to injuries. And while that may be true, that is ignoring the underlying cause of why certain athletes get injured with certain injuries. And in rehabbing them, trying to get them back, those issues are still ignored, predisposing that athlete to further injuries, which is what we see, the re-injuries. So the problem is today's system is 100% reactive. And again, while our training staff and our therapists can do functional movement screens or gait analysis, they're just missing the fact that every human is asymmetrical. There's foot collapse differently, right versus left. There's leg length differences. There's rotation of the pelvis. There's abnormal centers of gravity. All of these factors govern what the risks are for injury, and yet no one is looking at them. So let's go through and kind of see where things are at. This is a typical traditional school exam for all athletes to go through preseason. And you'll see the left column in the center, eyes, ears, lymph nodes, thyroid, nose. To the right column, epilepsy, nervous system, but down at the bottom, orthopedic, feet, posture, structural, and scoliosis. So first of all, limited information on the musculoskeletal system, that is the very system that is at greatest risk for injuries. And then the examiner has very limited knowledge of how to examine those areas. And probably what happens is the question, how are your feet? Okay, stand up. Yeah, your posture looks pretty good. And then they do a quick scoliosis screening, which I can tell you from experience, in most cases they're wrong. And that is the musculoskeletal exam, looking at the imbalanced student and never finding the imbalances or making corrections. So we have a graph here. In this graph, it represents everybody from the feet, where there's collapse of the feet, the right knee, they call that an increased Q angle. You'll look at the most important measurement of the body, which is the height of the hips. And if and when that is unlevel, you have imbalance in weight distribution in the lower extremities, predisposing one leg to have Achilles, to have plantar fasciitis, to have calf or hamstring pulls or tears, ACL injuries, MCL injuries, because it's got more weight going through that side than the opposite side. But in addition, the spine is now sitting on an unlevel foundation, predisposing that low back and disc injuries and low back injuries to occur. So even at this level, no one in sports medicine is looking at the athlete. So we call this Actuary Alex because we have the Concerned Parents of Young Athletes program. And at the age of 12, we do the testing that will identify these faults, and we will begin to make the changes because every other athlete at the age of 12 has a price on them. What is the cost for that human being during their lifetime, all the way from injuries at this age to joint replacement, disability, and loss of quality of life later in life? And here's just a very clear picture of what we're talking about. That left knee rotated in at an increased Q angle, left foot is collapsed, left quadricep disengaged. We can assume the hips aren't level because the shorts certainly aren't level. We have a second frame here that shows this is the same athlete at 13 years old, 15 years old, and 17 years old. We have new orthotics in his shoes at each level, but you can see the difference in hip height grows from 13 years old to 15 years old to 17 years old, and you want to affect that by using an appropriate size lift under the low hip orthotic in an effort to get the hips more level, because the goal is to fix the feet with orthotics to create symmetry and to get level hips so that there is even weight distribution going throughout the body. When we take a side view x-ray, you can see the long red line that represents the center of gravity. The short red line is where it should be. Now, when that center of gravity moves forward from where it should be, the weight distribution going through that lumbar spine and pelvis is going through areas that can't handle it. We can identify that, and there's a whole protocol of what to do in an effort to get those two lines closer and to also reduce the risk of injuries at the disc level, at the facet level, compression of the nerves, the muscles, the whole support mechanism. But if you don't know this young athlete has this, you can't do that. So the industry doesn't know that they have it. They don't know what to do with it if they did have it. And that's what we want to do. We want to take this system and we want to make it so that we have a national network of doctors that will be examining these young athletes preseason to determine what corrections can be made before injury. Costs are enormous. The leading cost in healthcare is the musculoskeletal industry, and that's because it's a reactive industry, and we treat athletes and we treat people after they are hurt. Just look at insurance. It will not pay for you to get a pre-injury examination or for maintenance care. It'll only pay for you when you are hurt. So that trains us to not do anything preventatively. Secondly, our docs in charge don't understand musculoskeletal, so they wouldn't know how to do a biomechanical exam and make corrective recommendations. So we do our structural fingerprint exam. We start at the age of 12. We want healthy, never injured kids coming into us. We will do a blueprint of them with our exam, and we will determine if their feet are collapsed. And here you can see we did a 3-year study of 1,001 patients, and you'll see that none of the feet were optimal, none of the feet had mild collapse, 10% were moderate, 90% were severe or total collapse. Then when we did the study of the 2023 Albany Patroons, a professional minor league basketball team, and we had 11 players, you can see 2 of the players had severe, 9 of the players had total collapse. So if you don't start with orthotics, you have a foundation that is thoroughly collapsed, and the athlete or the individual, without a doubt, is a much greater likelihood of injury because the very foundation is collapsed and typically asymmetrical. So we have developed the Dr. Mag's Feet First system. We have proven that all humans have varying degrees of collapse of the feet. You have to start with orthotics. So there are many out on the market. We recommend over the counter instead of custom, and that's another lecture, another day, but high quality over the counter, because you definitely want them symmetrical. You don't want them made independently, and you don't have to spend hundreds and hundreds of dollars for the orthotics. If you are a patient in our office, we have that orthotic for you. The price is much reduced from custom, but it's a very high quality orthotic. And we start all of our patients with orthotics. And we recommend every 2 years to get new orthotics and get a new x-ray to be able to see if the hips have changed in their height. And they do every couple of years. It's possible for that to shift. So here's an example of a young athlete who has orthotics in her shoes, yet is still 7.1 millimeters imbalanced. And if you didn't take that x-ray, you wouldn't know it. And therefore, it's a must for us to put a lift underneath her right orthotic so that we can get the hips as level as possible. We would use a 7 millimeter lift. So here you can see what that looks like. It's very easy process to go through and to put on, but it's monumental in what it can do to even the weight distribution so that repetitive activity doesn't have as negative effect as it currently does on many of these young athletes. Here is our before and after, and therefore there are things to do to create this after. That's what we're looking for with every athlete. And if we can do that with every athlete, we're going to change the healthcare system, because musculoskeletal is the leading cost in healthcare costs, number one. Number two, if you improve musculoskeletal, that will allow people to stay active longer. That will reduce cardiovascular disease. That will reduce obesity, diabetes. So there's no better place than to start with our youth. Start training them today as to how to identify your unique faults, fix them to the best of your ability, and what to do in your life to make your life a better life. So there's our message for today. Hopefully that'll help. And as always, stay tuned, because we're going to be here each week. I'll be here some weeks with Alan Gadsden, my co-host, and some weeks alone. So please take this message back to any family that has young kids, and set up an appointment, see if you can get an exam for structural fingerprint exam, and get on the right path today. Thank you much. Have a great week.